Hi, my name is Emma. I'm an osteopath at Osteomed Practice of Osteopathy. The following exercise is to be done under the recommendation of your healthcare practitioner and/or trainer. If the exercise gives you any problems or aggravates any problems you already have, or if any good pain turns to bad pain, then stop immediately and contact your healthcare practitioner. This is a technique, a soft tissue technique, using this ball, which you can do in different places, of course, but today I'm going to show you how to do it into the lumbar spine and the front, sides and back of the hips and the gluteal muscles. So this is a technique that you can use for any chronic problem, any tight areas in the lumbar spine or the hips, and or as part of your post-activity, post-training self-care routine. It's a very good technique to improve the blood flow into the areas, to work on trigger points as well, and if there's any more specific pain spots that you have. So for the lumbar spine, you have to remember that actually the area of soft tissue in that lower back is much smaller than you would imagine. You have here some bony bones we call the ilia, and then you have the ribs as well. So you want to be going in the space between those areas. So the ribs and the ilia, and you want to go in between. To do the back, the gluteals and the hips, you want to be on your back. This is one that you're going to have to play with a little bit, because for some people, depending on their pelvic tilt or how blocked their lumbar spine is in movement, for some people it's going to be better with both knees up, and for some people with one knee up. So you're going to have to play with it a little bit. But you want to be on your back and with your knees up. To do the lumbar spine, you lift that pelvis. Find the spots that you can feel is a bit tight, a bit painful, or a combination of those. And then put the ball into that area. Then you want to just relax onto that ball. And again, like with all of the exercises and stretches that we do, you want to work with that 3-point rule. So find a point of tension, wait for it to relax, and do that 3 times. And in this position, to increase the stretch, you can either drop the leg out to increase the pressure into the lumbar spine, or if you have the understanding of the pelvic tilt, you can see that in one of the other videos that we have done, then you can push with the pelvis into that ball. And then, as I've said, wait for it to relax and do the 3-point rule. There are going to be several places in that lumbar spine that you can do that technique. So once you've done that 3-point rule in one area, you can find another spot. To do the hips, the gluteal muscles and the hip rotators, exactly the same technique, exactly the same position. You just find different areas. So you actually, when you do the hip and lower back, if you do it both sides, you can spend a good 10-15 minutes even just releasing with this ball. So you're going to find a different particular spot, if it's painful or tight or a combination of both, and then put some pressure in it. When you feel it relax, increase the pressure, and then find the next spot. So if you're going to do the front of your hips, or the side of your hips, you're going to do it on your stomach. With this technique, you can work into the quadriceps, the upper portion, a small part of the psoas muscle, tensor fascia lata, and any, as we've said, tight areas that you feel in that soft tissue of the hip. So you want to come onto your stomach. You're going to have one leg out and be on your elbows. This is for full control. You're going to use the leg to come up and down to control the pressure on the hip. I'm showing you the leg position, but then I'm going to swap to show you how to do the technique. So in this position, I'm doing the right hip. I'm going to find a particular spot that's tight, painful, or a combination, and I'm going to do that 3-point rule on that spot. So find that tension, and when you want to increase the pressure, you're going to lift the pelvis or push down on the same side. And when you want to come more to the outside to do that tensor fasciae lata, you're going to twist a bit more with your pelvis in this way and leaning in to create that pressure. Thank you for watching this video. I have been Emma from OsteoMed Practice of Osteopathy.